This portion of the canine dentistry course, we will talk about management of oral masses. And when we're evaluating oral masses, many benign masses and malignant masses look the same. So we always want a biopsy, which gives us an opportunity to make decisions on margins. This is the most common oral mass that we see, and obviously determined by biopsy previously. But this is a peripheral odontogenic fibroma, or POF, and this previously has been classified as an epilus, either a ossifying or fibrosing epilus, and it's been those have been reclassified as peripheral odontogenic fibromas. And when we have that diagnosis, we can get minimal margins into bone and soft tissue to completely excise the mass, and any residual alveolus that's present adjacent to the mass, after we take a section of bone and remove the tooth, and the mass in its entirety undergoes alveoloplasty with a diamond burr to remove any additional soft tissue that would represent periodontal ligament fibers, which is the origin of these masses, and that's why the tooth has to be removed in addition to the mass in section. So looking at this one, this was associated just with that second maxillary incisor on the right side, and so we were able to go in and remove in section and go just marginally into the palatal tissue to remove this. We did excise we did incise the leading margin of the palatal mucosa here, and consequently the terminal arteries here are bleed a bit, but not enough to perform any hemorrhage control at all, just not significant enough to be concerned with. So once we've taken that into section, we go in with a diamond burr and make sure the alveolus is nice and smooth. There's no visual remnants of periodontal ligament there. We've done a couple of vertical releasing incisions here to get exposure, and then just taking that in section and remove the tooth at the same time. Here's the flap, and that will, and actually we've kind of curved that around a little bit to caudal to the vertical releasing incision so that we can bring this around. We're in this unattached gingiva here, so we can bring this around a little better, give us a little better closure without tension. As you can see here, we've used simple interrupted sutures for closure. We've got a nice tension-free flap there. Prognosis is excellent. We would have an Elizabethan collar on this patient to ensure that there's no self-mutilation, and chances of dehiscence are next to none as long as the pet doesn't get to that area. We always send those off at this point to make sure that we've gotten clean margins. I've yet to get one back that hasn't been clean, so we're usually into, or we're always into normal tissue by at least a millimeter, if not a couple of millimeters, just to ensure that we get everything. Here's another example of a peripheral odontogenic fibroma. It's slightly more invasive, going into the floor of the lingual floor, and you can see here a little more extensive. And so we're going to have to do a partial rostral mandibulectomy in order to get all of the mass and the bone associated with it, as well as the alveoli and the tooth. And so there's the complete excision on that. A little bit more aggressive, but still very conservative, and